It got to the point that I was not sleeping through the night. It was interfering with my job.
Believe it or not, I couldn't actually put my pants on hardly before the surgeries on my hands, but now I can. I still have difficulty writing, but before I couldn't write at all.
He didn't crawl, he could not sit up. I had to prop him up with a pillow.
Innovation doesn't happen without research. We are always striving to find new ways of doing things, new procedures.
Through research, we're able to adapt to the changes, and we're able to modify procedures and/or the products that we use for orthopedics to improve patient care.
My name is Christy Cadd, and I am the Executive Director of the OrthoCarolina Research Institute. OCRI is very well known in the research industry, but very few people in the Charlotte community even know that we exist. The OrthoCarolina Research Institute, or as we call it, OCRI, OCRI, is a nonprofit 501c3 research organization that is solely dedicated to research and education for the advancement of orthopedic health care. As part of our mission toward research and education, we also do quite a few events each year. OCRI educates both the medical community and the lay community through educational events like Oscar Miller Day, iPass charity event, and the Exploring program. We invite students in the Mecklenburg County school system, if they have any interest in an orthopedic career, then they can sign up and come and see what orthopedics is all about. Hands-on type of approach to learning. We also have a fundraising event that's called iPass, and iPass stands for Injury Prevention Across Sports with Science. While you can't prevent injuries, there is benefit in creating awareness. I think what makes our business model unique is that we not only work with industry to move FDA investigational research forward, but we also work much like an academic institution. We typically have around 25 to 30 research publications each year.
I was in the middle of my big tennis comeback and leapt forward to take a drop shot and heard a big pop, felt a smack on the back of my leg and realized that I'd damaged my Achilles tendon. And I was approached and asked if I would mind coming back for a couple of additional visits so that they could do some additional testing to ascertain how well the surgery had worked.
When Susan came to me and we were talking about fixing her Achilles, I discussed with her enrolling in a study where we were looking at this new technique that we had developed. She was very interested in whatever was state-of-the-art and could return her to activity quicker.
So it seems to have worked very well. And everybody who sees my ankle are always amazed, and they're looking for the scar. I'm back walking again and playing tennis, actually hiked to Machu Picchu in the summer, so I thought that was a pretty good test of the strength of my leg.
She's close to 2 years out from her procedure. She's playing tennis daily, working with her trainer, and she's very pleased with her outcome. She's able to do everything that she was doing before. If I asked her today whether she would do it again with this type of technique, she said she would.
I think it was about 6 months pregnant that I met Wattenberger, and at that time there's nothing we could do. His specific diagnosis is thoracic insufficiency syndrome. He's missing 5 ribs and 3 are fused together on the left side. They said that he's just going to have a very short life, 1, and the quality of life, 2, is going to be horrible.
There are conditions that in ways that we treat people that aren't approved by the FDA, meaning that we have to get special exceptions, the humanitarian device exception, and that's a pretty rigorous process, and I wouldn't be able to do that on my own without the staff from OCRI.
I do remember Wattenberger at the first surgery. He said, "You should have just saw his lung inflate," and he was really happy about that.
And he was the first veteran that we did here in Charlotte. And after we did the surgery, he was able to breathe a lot better and has lived a relatively normal life and just a great kid and with a great family.
I like to play flag football, either a quarterback or a runner back.
The quality of life he has with the implant outweighs the risk, in my opinion.
Thank you for saving my life.
We wouldn't exist without the assistance of our research volunteers. It takes a leap of faith to try something new that is currently under review and do it unselfishly for the greater good of others.
To go through these studies, if no one ever volunteers, then there's nothing that gets approved and nothing gets advanced that way. And if I was part of it, it does make me feel good.
Was beneficial to others, you know, so I didn't mind doing it at all.
It's not often that you get a chance to be part of a medical research project. I would definitely be involved in something similar to this again if I was ever asked. I'm happy to help, especially if I know that I'm helping other people improve their medical experience. You have to get your medical research from somewhere, so I was happy to help.
The technology that's available today is going to look completely different 10, 15 years down the road, and we want to be a part of that. That's the benefit of research. It's not what it's doing today, it's what it's going to do for our kids and our grandkids 10 or 20 years from now.